I'm going to walk through 7 signs today, and I want you counting along, either silently or in the comments. How many of these sound familiar to you? Vitamin D deficiency is surprisingly common after the age of 60. As we get older, our skin becomes less efficient at producing vitamin D from sunlight, and many of the signs are often dismissed as just getting older. My name is Dr. Lawson, an AI-assisted educational persona. This information is for educational purposes only. It's designed to help you recognize patterns worth discussing with your healthcare provider, not to diagnose a medical condition. The only way to know your vitamin D level is with a simple blood test. Let's begin. The first sign is persistent tiredness that doesn't completely improve with rest. This is one of the most commonly reported symptoms, but it's also one of the easiest to overlook because fatigue has so many possible causes. Vitamin D helps support how your cells produce energy, so when levels are low, you may experience a lingering sense of low energy or mental fog rather than the overwhelming exhaustion that comes with illness. The second sign is bone or muscle aches, especially in the lower back, hips, or legs. Vitamin D is essential for calcium absorption, helping keep bones strong and muscles functioning properly. When levels are low, you may notice a dull, persistent ache that's easy to blame on aging or everyday activity. The third sign is changes in mood or a general feeling of emotional flatness, particularly during the winter months. Vitamin D receptors are found in several areas of the brain involved in mood regulation, and research has identified an association between low vitamin D levels and mood changes. While this doesn't mean vitamin D deficiency causes depression, it's one factor worth discussing with your doctor if it fits your overall pattern. The fourth sign is slower healing of cuts, scrapes, or minor wounds. Vitamin D supports the body's natural healing processes and helps regulate inflammation. If you've noticed that small injuries seem to take longer to recover than they once did, it may be another clue worth mentioning during your next medical appointment. Before we continue, it's important to remember that none of these signs by themselves proves you have a vitamin D deficiency. Each symptom has many possible causes, and several are also common parts of aging. What matters most is whether several of these signs appear together as a pattern. The fifth sign is noticeable hair thinning beyond what's typical for your age. Vitamin D plays a role in the normal hair growth cycle, and some studies have linked deficiency with certain types of hair loss. It's rarely the only explanation, but it may be another piece of the overall picture. The sixth sign is getting colds or minor infections more often than you used to, or finding that they linger longer than expected. Vitamin D helps support normal immune function, and research has associated lower levels with a higher frequency of some respiratory infections. If you've noticed you're getting sick more often than in previous years, it's worth mentioning along with any other symptoms. The seventh sign is subtle muscle weakness, particularly in the legs, which can affect balance and increase the risk of falls. This is one of the better studied effects of vitamin D deficiency in older adults, because muscle strength and bone health are closely connected. Difficulty rising from a chair, climbing stairs, or feeling less steady on your feet may all be worth discussing with your healthcare provider. So, how many of these 7 signs sounded familiar? Experiencing one or two of them doesn't necessarily mean you have a vitamin D deficiency. However, if several of these signs apply to you, it may be worthwhile to ask your doctor about a simple blood test to measure your vitamin D level. It's a quick, inexpensive test that can provide a clear answer. If your levels do turn out to be low, treatment is often straightforward. Depending on your individual needs, your healthcare provider may recommend safe sun exposure, foods naturally rich in vitamin D or fortified with it, and an appropriate vitamin D supplement. It's best not to start high-dose supplements on your own, since excessive vitamin D can also lead to health problems. If you recognize several of these signs, let me know in the comments. I'd be interested to hear how many matched your experience. Vitamin D deficiency is common, often develops quietly, and can easily be mistaken for normal aging or other health conditions. That's why recognizing the overall pattern and confirming it with a simple blood test is so important. If you found this information helpful, consider subscribing for more evidence-based health education. Thanks for watching, and I'll see you in the next video.